Thank you for joining our next blog concerning analgesics, and today is all about NSAIDs. My name is Phil Walls, and I'm Chief Clinical Officer for MyMatrix. Non-Steroidal Anti-Inflammatory Drugs. This is a category of drugs that was developed to solve some of the issues we have when it comes to using steroids to treat pain. And here I'm referring to the corticosteroids, substances like cortisol, drugs like prednisone, that will relieve pain by relieving inflammation. Extremely effective, but also extremely fraught with side effects. NSAIDs were the drug industry's attempt to develop a category of drugs that weren't based on a steroid, but would produce the same effects, hopefully with fewer side effects. Now, what we know today about NSAIDs is that all NSAIDs cause some degree of side effects, especially when it comes to cardiovascular disease. The older ones will also have an effect on the stomach lining, possibly causing ulcerations, as well as an effect on blood clotting. Newer ones, although they're not so new anymore, they're all available generically, but newer ones like Celebrex, which is now available as the generic celecoxib, was a more refined NSAID, and it's referred to as a COX-2 inhibitor, standing for cyclooxygenase inhibitor. The significance of this is simply that this was a more specific drug that was more targeted, and the theory being that it could reduce inflammation without causing the side effects on the stomach and the cardiovascular system. Well, they hit a home run when it came to the effect on the stomach, but unfortunately, this category, the newer COX-2 inhibitors, also have an effect on the cardiovascular system. So on your screen right now, you'll see a listing of NSAIDs from those with the least cardiovascular effect to the ones with the greatest cardiovascular effect. To the prescriber, this is an important factor when they're viewing a patient holistically. In other words, not just treating an injured worker, but looking at the patient in terms of what other conditions do they have, especially cardiovascular disease. That is paramount in the selection of one of these drug products. Thank you again.